Good afternoon, folks. I've got B for you. The study, comorbidity, and health related quality of life in people with a chronic medical condition in randomized clinical trials. An individual participant data meta-analysis offers a sweeping data rich examination of how multiple chronic conditions shape the lived experience of patients and influence outcomes in clinical trials. It's a landmark effort to bridge the gap between tightly controlled trial environments and the messy realities of multimorbidity in everyday clinical practice. Study purpose, reframing clinical relevance. The researchers set out to answer a deceptively simple but clinically urgent question. Does having more chronic conditions affect how patients feel and respond to treatment in randomized trials? Specifically, they explored whether people with more comorbidities start out with worse health-related quality of life, to whether their HRQOL changes differently over time. 3, whether comorbidity modifies the effectiveness of treatments aimed at improving HRQOL. This is critical or crucial because most clinical trials exclude or underrepresent people with multiple conditions, despite the fact that multimorbidity is the norm, not the exception in real world healthcare. Methodology, a meta-analysis with muscle. This wasn't your average meta-analysis. It was an individual participant data analysis. Meaning the researchers didn't just pull summary statistics. They reanalyzed raw data from 56 randomized trials, encompassing 33,000 participants, 16 chronic conditions, e.g. diabetes, COPD, heart failure, 23 drug classes. They used gold standard HRQOL instruments. EQ-5D captures 5 dimensions of health, morbidity, self-care, usual activities, pain and discomfort, anxiety, depression, and converts them into a single index score. SF36 offers a more nuanced profile across 8 domains, including physical functioning, vitality, and emotional well-being. Comorbidity was quantified using a count of 21 predefined conditions based on medical history and medication use. The findings: multimorbidity matters, but not how you might expect. The results were both sobering and surprisingly hopeful. Baseline HRQOL was significantly lower in people with more comorbidities. This aligns with what we know. More conditions often mean more symptoms, limitations, and uh, distress. HRQOL tended to decline more over time. Those with higher comorbidity counts. And the key comorbidity did not distinguish treatment effectiveness. Patients with multiple conditions experienced similar improvements from interventions uh, as those with fewer conditions. This challenges the assumption that multimorbidities uh, dilutes treatment benefits and suggests that trial findings might be more generalizable than previously thought. Implications toward exclusive, equitable evidence. This study was widely reaching implications for clinical practice, research design, and health policy. Trial data informed care for patients with multimorbidities. Especially those with moderate levels of complexity. Generic HRQOL measures like EQ5D and SF36 are valid across diverse patient profiles, supporting their use in both trials and routine care. Exclusion of multimorbidity patients from trials may be unnecessary, and future studies should embrace broader inclusions criteria for health system grappling with aging populations and rising chronic disease. Design, interpret, and apply clinical evidence. Limitations. still needed. Despite its strengths, the study has some caveats. Most participants had fewer than three comorbidities, so results may not apply to those with more complex or severe multimorbidities. Comorbidities counts do not or don't capture disease severity, interactions, or social detriments, which can profoundly shape HRQOL. The trials included were mostly pharmacological, so findings may not extend to behavioral or system level interventions. Okay, guys, so that is B for you. I will see everybody tomorrow for shows. For now, Gator Wellness, take care, folks. Have a good afternoon. See everybody tomorrow for shows.